Good afternoon. Welcome to the Emory Living with MCI Dementia webinar series. My name is Jenny Gay, and I'm a social worker with the Integrated Memory Care Clinic. I'm joined today by my social work colleagues, Alice Cooper Salisbury and Ashley Barner with the Cognitive Neurology Program, and Debbie Young Arnold with the Charlie and Harriet Schaefer Cognitive Empowerment Program. This is a monthly webinar with topics relevant to people affected by mild cognitive impairment and dementia, both those living with the cognitive changes and personal and professional care partners. We meet the second Wednesday of each month at noon. The topics presented are based on requests from the audience, so please always feel free to let us know about topics you'd like to hear. You can do that in the Q&A section. Previous webinars can be viewed on YouTube at a link that we will plug into the chat. And also soon to come, we will have flyers that are created by our colleagues at the Georgia Memory Net, which will have a QR code. So those are soon to come. And again, that'll be put in the chat for today. Since this is a webinar, the audience cannot be seen or heard, but you can go ahead and put questions in the Q&A section, and we encourage you to do this. We'll have time at the end for questions, but feel free to drop your questions in the chat throughout the presentation. We all know how easy it is to forget our questions if we don't put them in there. So without further ado, I'll let Ashley take it away, but thanks for being with us today.
Thanks, everyone. Thanks, Jenny, and thanks, everyone, for being here. We have a wonderful crowd today, which speaks to the importance of resources for all of us. Ginger Reagans is the Atlanta Regional Commission's Aging and Disability Resource Connection Consumer Information Services Manager. The Aging and Disability Resource Connection is also known as the ADRC. You may hear that terminology. As manager of the ADRC, she is responsible for managing all aspects of consumer information services, to include direct management and oversight of the certified information and referral counselors, options counseling, the Benjamin Rose Institute Care Consultation Program, which she's going to tell us more about, and the ePro Resources team, which is, I think, one of her favorites. The ADRC encompasses all of the programs that the state of Georgia sponsors for older and disabled residents, including those affected by MCI and dementia. Ginger is also adjunct faculty at both Georgia Southern University and Brenau University. And finally, Ginger is one of my favorite people because of her passion for gerontology and aging services. So I'm going to hand it to you, Ginger, to tell us all about what's out there for in terms of resources and connections.
Thank you so much, Ashley. I so appreciate it. And this is one of my favorite groups. I love coming and speaking with you about resources and how we can help. So I want to get you educated today on what the ADRC is. So let me share my PowerPoint. All right. Can everybody see my PowerPoint?
Yep.
All right, perfect. It worked. All right, everybody. Again, Ashley told you all who I am. I am Ginger Reagans. I'm with the Atlanta Regional Commission's Area Agency on Aging. And here is our slide about our vision, mission, values, and goals. We are one great region, and our mission is to foster thriving communities for all within the Atlanta region through collaborative, data-informed planning and investments. So let's get to the meat of the presentation. What is an ADRC? An ADRC is the Aging and Disability Resource Connection. Every region in the state of Georgia, as well as the country, is covered by an Aging and Disability Resource Connection through an area agency on aging or a center for independent living. Now, Georgia has 12 ADRCs serving all 159 counties across the state of Georgia. So just know in the state of Georgia, every county is covered by an ADRC. So as the ADRC, we kind of serve as that entry point for folks to call in to learn about resources and services for long-term care support. We're not a place or a program but we're a coordinated system where we work with you to share resources and services that might help you in your need and your crisis. So how to get to us? Well, the first point is to call 1-866-552-4464, then press option 2, then option 4 to reach any ADRC in Georgia. And then, of course, I've listed the website here. And as nationally, you could contact the elder care locator. So you might want to take a screenshot with your phone if you want to. So that's some information of how you can contact an ADRC in the state of Georgia. So here at the Atlanta Regional Commission, we cover 10 counties. We cover Cherokee, Clayton, Cobb, DeKalb, Douglas, Fayette, Fulton, Gwinnett, Henry, and Rockdale. So if you are in one of those counties, you will be forwarded to the Atlanta Regional Commission's Area Agency on Aging for services. And then, of course, we have the map to kind of show you the breakdown of each AAA, Area Agency on Aging, in the state of Georgia. Empowerline, that is also known as our ADRC, and we have a wonderful website. You can just get lost in that website to learn so much about what is offered out there in our community. The website is empowerline.org, and our direct phone number is 404-463-3333. So I know I'm throwing out a lot of phone numbers and websites to you, but I want you to be educated on where you can contact us. But for the main number, the 404-463-3333 number is the one that you want to connect with. So on our website, you can do a self-serve. You can find services such as housing, transportation, perhaps personal care homes, that sort of thing, or you can just give us a call and we'll be glad to talk with you about those needs. And some of the things that we do here at the ADRC is we provide information and referral assistance, our ePro resource database, our intake and screening for HCBS, which is home and community-based services, non-Medicaid services, and the elderly and disabled waiver program. We also talk about assistive technology, the BRI Care Consultation Program, and then we have a TruAlta educational platform, our one-to-one telephone reassurance, evidence-based programs, and we have 1.5 dementia care specialists in our agency, which I'll share more about in just a few minutes. So for the information and referral assistance category, that is where our counselors here in the ADRC are certified through the Inform USA, which is a national organization. And for fiscal year 25, get ready for this. We handled over 134,781 contacts. That is how many calls, emails, walk-ins that we received during that time period. We stay pretty busy, but that just speaks to the need of services and resources in our region. And then Empowerline Pro, also known as ePro, that is our extensive resource database of more than 26,000 services and resources. We are able to go to that resource database and find housing, transportation, financial assistance agencies, personal care homes. I mean, the list goes on and on. So we are prepared to handle those calls with our extensive resource database. So why would someone call the ADRC? Well, I've listed out a couple of reasons. One would be a current crisis where perhaps you're caring for your mother and she just had to go to the hospital and now is going to have to go to rehab for a couple of weeks and she's not going to be able to come back home by herself for a little bit. So you want to know what your options are. So we will certainly talk to you about that. Stressed caregiver calling for help. That could also be that daughter who's stressed about caring for her mom, but it could also be that that caregiver is juggling with taking care of her children, taking care of her mother, just trying to balance the time for everybody. And we can talk to her about some programs that might help. And then just looking for resources. That could be looking for housing, transportation, emergency financial assistance. Somebody may have a past due utility bill and they want to know if there's an agency out there that could provide some assistance. And then they know they need help, but don't know what is available. That is a popular phone call. Someone will call in and say, I was given your number to call in. I don't know what I need, but let me tell you what's going on in my life and let's see what you can do to help us or help me. So that is where we come in and try to save the day if we can. And what are the most common caller requests? Transportation, which that's one that you could imagine, right? Because we have a lot of individuals who don't drive and need to get to a doctor's appointment or perhaps a dialysis appointment, and they do not have transportation. So we're able to link them up with some transportation resources that can assist. Housing, someone may be looking for subsidized housing or non-subsidized housing or a personal care home, that sort of thing. In-home services, which could be housekeeping, personal care services, and then caregiver support, where caregivers are needing that support, needing to know how to take care of their loved one and ultimately take care of themselves too. So the online referral process. So the Atlanta Regional Commission does not accept referrals via fax. Instead, we have a website that you can go on and submit a referral form. And I've listed out the information here, but again, you may want to just take a screenshot so you would have that information. But anybody that is interested in a Medicaid waiver or the home and community-based services, you can go to our website and click on the referral form to submit that. And then somebody will reach out to contact them to talk to them about that referral. Home health. So the ADRC does not include home health. We do get a lot of calls saying, my doctor told me to call you so we could set up home health. And then we typically have to educate that caller to say, we don't set up the home health. You'll need to call your doctor again and perhaps ask one of the nurses to help you set that up. Perhaps get a prescription, get a list of home health agencies and set it up through there. But that is definitely not something that we do. We just suggest you go back to your doctor and let them, help support you in that endeavor. And then, of course, most times health insurance and or Medicare, will pay for that service. So now we're going to start talking about some of the programs that we offer. The first one is Home and Community-Based Services, which is also called HCBS. This is a non-Medicaid service, and it's one of the most popular programs, and it's funded through the Older Americans Act. And this one is funded through the county. So you must be 60 plus years of age. Anyone, regardless of age, who is diagnosed with Alzheimer's disease or related disorder may be eligible for HCBS. And here's a list of some of the in-home services that might be offered. There's home delivered meals, homemaker, which is housekeeping, personal care, respite care, case management, senior recreation, that's where you would go to the senior center, congregate meals, you would have that congregate meal at the senior center, transportation, home modification repair service, and adult day programs. So there's a lot of services that can be offered in this program. There may be a possible fee for services based on a sliding scale, but the counselor will assess you for the service and then forward you to a wait list, and then the county would talk with you about that fee. So how does somebody apply for home and community-based services? Again, you would go to our website and click on that referral form, fill that out in its entirety, submit it, and somebody would give you a call. Or you have a couple of other options. You can call us direct at 404-463-3333. That's here in our region. And then statewide, I have the number there listed, 1-866-552-4464. The screening will take about 30 to 45 minutes to complete because they're going to be talking with you about your ability to perform certain activities, and it's really used to determine the risk level, the level of care that you might need in the home. Services can take 6 months or longer to begin, depending on county funding. So this service is not immediate. It does take a little bit of time to secure in your home. Typically, after we complete that assessment, we're going to place you on a wait list. And then once that county has funding for that position, then they will notify us and then they will remove you from the wait list. But it can take some time. And I really just wanted to let you all know that it is not an immediate service. Now, the Elderly and Disabled Waiver Program. This one is pretty popular. So you may be familiar with CCSP, Community Care Services Program, and SOURCE. Both of those fall under EDWP, the Elderly and Disabled Waiver Program. We only screen for CCSP, and I'll talk about that in a future slide, but I wanted to just say that CCSP, that is the community-based care, and it is an alternative to nursing home placement. Because after all, our goal is we want older adults and those who are disabled to be able to continue living in their community, right, and into their household. So this program allows them to do that with some assistance. I also This is a pretty popular question, so I added it to my PowerPoint. Legal residence date of entry on their green card must be 5 years or more to be eligible. We get that question a lot, so I wanted to be sure that I educated you on that. Individuals with refugee status do not have to wait 5 years. So just keep that in mind, that legal residence, the date of entry on that green card must be 5 years or more to be eligible for the Elderly and Disabled Waiver Program. So eligibility, here are a few key factors for eligibility. Individuals who are 21 and over, there must be a functional impairment caused by physical limitations, and that does include dementia diagnosis, but not a mental health diagnosis. There must be an unmet need for care. There must be an approval of an intermediate level of care, or LOC, certification for nursing home placement. There must be an approval of the care plan by the client's physician, and that individual must be Medicaid eligible or potentially eligible after admission to the Elderly and Disabled Waiver Program. The client chooses community-based services rather than institutional services, and you can only participate in one waiver program at a time. And another thing that they have added is the home environment is free of illegal behavior and threats of bodily harm to other persons. So those are some key factors to determine eligibility for the Elderly and Disabled Waiver Program. Here's a list of services that are offered with the Elderly and Disabled Waiver Program. There's case management, adult day health, alternate living services, and that's for a personal care home. Emergency response services, that would be the necklace or the watch that somebody would wear. If they were to fall, it would notify that service. Respite care, structured family caregiver, home delivered meals, consumer directed personal support services, and then home delivered services. And there are a few things in that category. For instance, skilled nursing, physical speech and occupational therapy, medical social services and home health aid assistance, and personal care and assistance with meals. Structured Family Caregiving Program, also known as SFC. So this came about a couple of years ago, and it's a pretty popular piece to the Elderly and Disabled Waiver Program. It is an approved service to provide support to family members who live with and provide 24-hour care for an elderly or disabled family member, both through the support provided by health coaches and the provision of a daily stipend. The service is designed to support live-in family caregivers unable to work outside of the home because of their caregiver responsibilities. Now, the care receiver, that is the client, must first satisfy the eligibility requirements for EDWP before SFC would come into play. That caregiver who is interested in being that family caregiver, they must be at least 18 years of age. They must be related to the care receiver. They must live in the same household as that care receiver, under the same roof, be willing to work with the agency's health coach, be willing to submit daily care notes electronically, and pass a criminal background check. The caregiver may not have any other form of employment, and the caregiver may not be the spouse, legal guardian, and/or conservator of the care receiver. And this component, SFC, is only available through EDWP waiver. Cost share. I really wanted to take a minute to educate you about the cost share, because some people think that the Elderly and Disabled Waiver Program is free, and to some, depending on their income, there may not be a cost share, but I wanted to kind of educate you a little bit about what a cost share means. So if income exceeds the Supplemental Security Income, SSI limit, and currently in 2026 it's $994, you may have to pay toward the cost of your service. This amount would be called a cost share. So the monthly income determines how much of the cost share is paid each month. And I listed an example here. So to make math easy, if your income is $1,294, you would subtract that SSI limit of $994, and then that would determine a $300 a month cost share. That is how much would be paid for services monthly. The provider of the service bills the client monthly for the cost share. And then, of course, the actual amount of the cost share is determined by the Division of Family and Children Services, also known as DFACS. If the cost share is not paid, the provider has the right to stop services. So it's just very important that individuals know that there may be a cost share. But when you call one of our ADRC counselors and you're talking about the Elderly and Disabled Waiver Program, we're going to go through that list of things with you for eligibility. We're going to ask you what your income is, and we will estimate that cost share for you. So we're not going to leave you stranded. We will give you some idea of what that would be. And of course, sometimes we do have people to decline EDWP because of the cost share, because it is a burden to have that much money to come out of their monthly income to pay for services. And we certainly understand that. Then, of course, there's also Georgia Medicaid Estate Recovery. I'm not sure if you've heard of that, so I wanted to share that today. Estate recovery, that's the process of obtaining reimbursement for claims paid by Medicaid from the estate of a deceased Medicaid member. The estate recovery statute has existed in Georgia since 1981. It only estates valued at 25,000 or less are exempt from Medicaid estate recovery, and Medicaid estate recovery applies to those over the age of 55 with few exceptions, but it does apply to the EDWP waiver, the ICWP waiver, and then skilled nursing facility Medicaid clients. You must have property or cash that is worth more than $25,000. So anything over $25,000, for instance, maybe your home value, that would be subject to Medicaid estate recovery. Recovery may be delayed if the deceased member's spouse is alive, has a living child under the age of 21, or a living child of any age who is blind or permanently and totally disabled pursuant to the title under the Social Security Act. Now, a lot of people will have questions about this because everybody's situation is unique. So I've listed here some resources that you could reach out to become more educated on Medicaid estate recovery. So I would suggest calling the Senior Legal Hotline, and that number is 404-657-5328, or Georgia Estate Recovery, and that number is 770-916-0328. We typically don't get in the weeds on a phone call about Medicaid estate recovery, but we will certainly bring that up to you. If we're interviewing somebody that owns a home, the value is more than $25,000, then we would say that that may be subject to Medicaid estate recovery, and we're going to give you these resources to contact to become better educated about how you can handle Medicaid estate recovery. So how does somebody apply for the Elderly and Disabled Waiver Program? Of course, you're going to go to our website, click on the link for the referral form, and complete that in its entirety. You could also give us a call at our Empower Line number, 404-463-3333, and speak with a counselor, and then they would, of course, do that assessment. We do the intake and screening for CCSP only. We do not screen for source, but if you call in and you are looking for source, then we're going to give you a resource list of source case management agencies that you can contact and be screened. The screen takes about 30 to 45 minutes, similar to the HCBS screening we talked about earlier. And of course, it does involve answering a series of questions related to your ability. Can you perform these daily functions in your household? And then services can take 60 to 90 days or longer to begin, depending on approvals through Alliant and DFACS. And Alliant is the organization who they will determine if this client has met those eligibility requirements for the physical limitations. So the case management agency would get that approval, and then of course things would then move over to DFACS to start that process. So it can take some time, and again, it's just not an immediate service. It does take time, and we know that DFACS can be backed up due to the volume of clients that they're reviewing. So we just always, want to educate that caller that it can take 60 to 90 days and sometimes longer to process. What is assistive technology? This is one of my favorite topics. So, assistive technology, it can be any item or piece of equipment that is used to increase, maintain, or improve the functional capabilities of individuals with disabilities in all aspects of life. And you'll be surprised at what might be considered assistive technology. And we have learned through different challenges that it can require different assistive technologies. And we may not think that a shower bench is an assistive technology gadget. The walker, that is also an assistive technology gadget because those things ensure mobility independence. And then there's another gadget like Reminder Rosie that can remind individuals when to take their medicines or to call their doctor. Of course, now we have Alexa and Siri that can do that as well, but Reminder Rosie is a little less evasive in the home. And then there's a Robo Twist jar opener. That is a gadget that can allow someone with arthritic hands to open up, let's say, a jar of spaghetti sauce. You may have arthritic hands and really are challenged with opening up those jars. Well, you can buy that Robo Twist jar opener for under $20 at Walmart. Put a double A battery in, pop that gadget on top of that spaghetti jar, press one button, and it is going to open that jar for you. So that's such a simple gadget that can mean so much to an individual who may struggle to open up jars. And this quote here is from an IBM manual back in the early 80s, but it just really fits for assistive technology. For a person without a disability, technology makes life easier. For a person with a disability, technology makes life possible. So, just think about that little gadget of the Robo Twist jar opener, how it really helps improve someone's lives. The ideas are endless of how we can use these tools to support independence, and we're all about it because our ultimate goal is to have someone to live in their home safely and with the service that they need and with assistive technology. So how do you pay for assistive technology? It could be pretty expensive, right? Well, I wanted to list out a couple of agencies that you could research to get some information on. There are some government programs that can help, and then of course there's medical equipment, also called durable medical equipment. Um, Such as canes, walkers, wheelchairs, and scooters. If your physician prescribes those, insurance may cover that. But then there are some that insurance will not cover, like grab bars, bath mats, dressing aids, that sort of thing. So here's a list of agencies that you can look out to: Medicare, Medicaid, private health insurance plans. We're hearing more and more about those these days, that the Advantage plans are helping to pay for AT. Public service organizations like FODAC, United Way, there's ICANN Connect and Easter Seals. FODAC is in Stone Mountain. It's Friends of Disabled Adults and Children, and they have a huge warehouse of equipment. You can just give them a call, and they'll be able to connect you with some resources. There's Credit Able, Dollars and Cents. There's the National Family Caregiver Support Program, the VA, local centers for independent living, and then my personal favorite, us, the Aging and Disability Resource Connection. So we do have some eligibility requirements. The individual must be 60 plus, and we need funding, right? So sometimes we get funding where we can purchase assistive technology items for our consumers, but when that money runs out, we have to pause the program. And I can say right now we have ran out of money, so we have paused our assistive technology program as far as the funding piece goes. But if somebody were to call in and you know, they were curious what assistive technology was. Perhaps we offered some suggestions of some gadgets that may help them. Then we're going to give them a list of where they might be able to purchase those items or where they can get assistance with getting those items. So we're not going to leave that person hanging, by saying, oh, we don't have funding, we're unable to help. That is not what we do. We will certainly give them another resource to look at. But I did want to mention that right now we have had to pause our funding piece to the assistive technology because we have ran out of money. BRI Care Consultation Program. This is a free Did you hear that? Free telephone-based information and coaching service. So it's for older adults with memory and/or physical impairments in their family or friend caregiver. So that caregiver can give us a call and just tell us, are you taking care of your husband, your wife, your adult child, or your mother or your father, or a sister or brother or a cousin, even a neighbor? you know, uh, just give us a call if you need support, because what we're going to do is we're going to hop on that caregiver journey for a year, and we're going to be in touch with you on a monthly basis. Of course, if you need something, in between calls, you can certainly give us a call and we'll help you. But we kind of personalize a coaching plan of how we're going to teach you to be a caregiver to your person. And, we hope after that year that we're going to kind of take those training wheels off and you're going to be able to just sail through being a caregiver. Of course, we always know that obstacles come up and it can be a challenge, but we're always here to help. But that's kind of our motto with the BRI Care Consultation Program is we just want to hop on that journey, help you navigate those challenges as a caregiver. We know you're going to hit those obstacles, those roadblocks, the detours, but we're going to try to help you get out of that. The BRI Care Consultation Program is evidence-based. There's a lot of research backing it up. And if you're interested in that program, our number is 1-844-557-1686. And the email address is careconsultation@atlantaregional.org. And did I say it was free? So keep that in mind. And we also have a partnership with TrueAlta. And guess what? It's free, another free opportunity. So, TrueAlta is an online educational tool that helps caregivers learn about health issues, care techniques, and managing care for their loved ones safety and confidently at home. One of my favorite videos on this website is how to talk to my loved one about stopping driving. That is one of the toughest conversations, but they have some information on the TrueAlta platform that can help you navigate that conversation and give you some tips. It's very helpful. If your loved one has diabetes, it kind of helps you to come up with a healthy diet, just tools to be successful in your role as a caregiver to your loved one. Now, TrueAlta is open to our family caregivers here in our region. And again, it's those 10 counties that we service: Cherokee, Clayton, Cobb, DeKalb, Douglas, Fulton, Fayette, Gwinnett, Henry, and Rockdale. You'll just want to go to empowerline.truealta.com and self-register, and it will just take you from there. And you can just put in simple topics in the search button, and it will generate videos, articles, just anything you might need to become better educated as a caregiver. Evidence-based workshops. We also offer a series of life enriching workshops at no cost, free for you to participate. If you're interested in those workshops, here is the phone number: 470-378-1630. I'm sorry, that's 470-378-1630. You can also see a list at georgiahealthmatters.org. But I have kind of a sampling, but it might be a little small. But I just wanted to kind of highlight on some of these courses that we offer for free. Aging Well with Your Pain. It's a 6-week workshop, about 2.5 hours once a week. Aging Well with Your Health Conditions. It's a 6-week workshop, 2.5 hours once a week. Aging Well with Your Diabetes. 6-week workshop, 2.5 hours a week. Powerful Tools for Caregivers. 6-week workshop, 1.5 hours once a week. A Matter of Balance. This is great. It really helps you to gain your balance. It helps with fall prevention. It's a wonderful course to take. It's 8 weeks, 2 hours once a week. And then Tai Chi for arthritis and falls prevention. That's an 8-week workshop, 1 hour twice a week. I used to teach Tai Chi for arthritis and fall prevention, and it was a wonderful program. I still do it because it helps. It's just a great program, and there's just something soothing about Tai Chi. So you really should look up a workshop for Tai Chi. Bingo Size, it's a 10-week workshop, 1 hour twice a week. And then Aging Mastery, a 10-week workshop, 1.5 hours once a week. one-to-one telephone reassurance program. This is for those older adults who may be lonely, socially isolated. We want to be able to reach them if we can because we know that loneliness and social isolation can pose very real health risk. For instance, prolonged isolation has been shown to be as bad for your health as smoking 15 cigarettes a day. So we want to see what we can do to help that. So on our website at powerline.org, you can just type in one-to-one and it will take you to some resources where you can learn how to sign up to be a volunteer or how you can start receiving that service. One-to-one is free. It really is a volunteer-based program where that coordinator is going to connect that older adult who may be lonely or suffering from social isolation. They're going to pair them up with a volunteer, and then that volunteer is going to be in contact with them on a regular basis. They kind of develop that companionship and just kind of help them along the way. It's a great program. So if anybody out there that might be interested in volunteering, I know they're always needing volunteers. So that might be something that you can look into. But just go to our website, empowerline.org, search one-to-one, and you'll be given all that information. Now, when we first started, I talked about dementia care specialists. I said we have 1.5 dementia care specialists here. So here at our area agency on aging, we receive funding for 1.5 full-time equivalent staff. So we have 1.5 individuals who meets the qualification for a dementia care specialist. And their purpose really is to increase dementia awareness out in the out in the community. We want to educate everybody about dementia, what resources are out there, what support programs are out there, how you can even be, you know, um, diagnosed with dementia. We just want to get the word out, get that education out there in the community. So that's what our dementia care specialists do. And they work closely with GMN, Georgia Memory Net, because we feel by building a strong communal network, care partners will have the resources, skills, and support to keep the individual living with dementia residing in their current environment for as long as possible. That's it. I know I probably went a little fast, but we just have so much information to share. I'm going to stop sharing so I can start hearing what some of our questions are. But I just want everybody to know, don't be scared of resources and services. We know that sometimes things come up and you may be experiencing a crisis, but give us a call. That's what we're here for. We want to put your mind at ease. You know, one of the things we do have to say though, sometimes is there's just maybe not an immediate service, but we're going to try to work with you to find some alternative options. So we're here to help. All right, I'm going to turn it over to you. Let me know what questions you got.
Oh, Ginger, thank you so much
Of
because you've
course.
given us a wealth of information. I mean, from financial all the way to educational, all the way to the emotional support when it comes to feeling lonely. So we
That's
really
right.
appreciate that. So a couple of questions.
Okay.
There's a caregiver who's talking about they're working with a company that assists their mom with meals, like housework, medication assistance. How would they use this company as their mom's support via CCSP, EDWP? They're wanting to know, it sounds like, can they take this company that they're already working with and work with them through the EDWP?
Possibly. I know Mom's Meals, that is one of the providers through the EDWP program. So if they're already receiving that, that might, they wouldn't lose that service, hopefully. But if they are interested in maybe transitioning from paying for that into CCSP, then what they want to do is just give us a call at 404-463-3333 and kind of explain that situation, that you've got these services, you're paying for it, and you want to know if that, your loved one would be eligible for the service. And we can certainly talk with you about that.
You for that. I think
Hmm.
they're questioning also, is there a difference in terms of pay? And would Empowerline even know something like that in terms of how much they're getting paid? And is there a cap if they go under CCSP?
So what we would do, we would ask what the income is. So if that individual is single and if they make over $994, whatever is over $994 is going to be that cost share. So when you call in, it's really important that you know what your loved one's income is. We just always suggest either, look at a bank statement, look at the Social Security website, so you'll know what that income is. So you'll have it in hand, because when you call us, if you say, oh, I'm not sure what the income is, it's really hard for us to help you determine that cost share, and we hate for you to have to call back. So, we would just suggest that you know what that person's income is and give us a call, and we can give you, what that estimated cost share would be. But if it's over $994, then there would be a cost share.
Thank you.
Mm-hmm.
Also, the same person talks about their mom was currently on the waiting list, and they initially signed up back in 2024
Mm-hmm.
and didn't receive a call back until February 2026. And so when you talked about that 6 month thing, they're wanting to know, so does that mean now it will be like September or October in terms of maybe that 6 months?
Now, when they signed up, do you know, I'm thinking it was probably Home and Community-Based Services, that's probably the program that they signed up for. And I'm curious, is it Fulton County? Because Fulton County, has a lot of people, and we have a lot of people on that wait list. So if, your mom was screened in 2024, then every year that they're on that wait list, you have to do a rescreen. You're mailed a letter, and you're told to call back in if you want to remain on that wait list. So it's really important that you call back in to get that rescreen. So it sounds like, that was done. And then it will be done again. You got it February 2026, and it probably shouldn't be done until maybe March. But if you would maybe email me, my email address is gragans@atlantaregional.org. I would be glad to look up your mom's case, and we can kind of look at that so you'll know what to expect.
Cynthia,
So
you are so good because yes,
yeah,
it is
yeah,
Fulton County.
yeah. So Fulton County, I said could be 6 months or longer, and I really didn't want to have to highlight that, but Tanya, she knows. I mean, Fulton County, the other counties typically are not that long. Fayette County, there's no wait list. Gwinnett, they're pretty quick. Cobb, Cherokee, they're pretty quick. But yeah, Fulton County, there's a lot of people on the wait list, and there's just not enough funding to support that demand. So yeah, but Tanya, if you would, please email me, and I'd be glad to talk with you about your situation. So again, Gragans, GRAGANS @atlantaregional.org.
Thank you. I think you have one more question. Just
Yeah,
finding affordable long-term housing has been very difficult due to budget constraints. Are
yes.
there art, are there alternatives?
It's very hard. And then, of course, with subsidized housing, you have to wait for that to come open, and it only comes open, a couple of times a year. And sometimes there's a freeze. So it is a challenge. But with that resource database that I talked about that has over 26,000 resources, what we could do is just plug in, what your limit is that you want to pay, and we can generate a resource list of housing options that you might be interested in. Now, I will tell you, some of them may have a wait list, but we can certainly try. So when you email me about your mom's case, let me know what counties you're looking for, and I'll generate that resource list and send it to you with some housing options and what the income is, of what you're wanting to spend. But we do always encourage individuals to call the local housing communities, agencies, so they can get on the list, or be educated on how to get on the subsidized housing list, because that is a lifesaver, but you really have got to be on when it's going to open up, because it can certainly help with the cost of living.
She said, thank you.
Okay, great, great.
Are there any other questions? I know a lot of information was given and
It was, and
trying to sort through, but have any questions right now?
Ginger, I think one of the most common questions that I get, in addition to questions about driving, and how to have that conversation, is about respite care. And of course, we're familiar with adult day programs and that CCSP can assist with adult day programs. But I think sometimes folks are going out of town for a weekend and or for a wedding and they can't have their loved one come. Can you speak to what you know about that, both in the Atlanta area, in your region, and then also
Sure.
throughout the state?
Sure. It is a challenge when somebody is looking for respite care for, let's say, the weekend or overnight. But what we suggest is that you can always give us a call and we can screen that caregiver for respite care. And there is a wait list for the respite care, but you can receive a certain amount of hours in a time block for that respite care. And if you are needing it for the weekend or overnight, and you've been determined eligible for respite care, we can give you some agencies that might be able to provide that. I know we had a case a couple of months ago where the agency just did not have an employee that could do that overnight care. So that was a challenge. The caregiver was eligible for the respite care, but the agency just did not have an employee. But we thought outside the box. We thought, can you ask somebody in your church? Maybe put an announcement. Your mom is familiar with her church members. Just put something out there. They put something in their church bulletin and they got almost too many people to volunteer to help. So it was funny. The caregiver said, now I have like a waiting list of people who want to provide support, when I'm in a pinch. So you really got to think of alternative options for that. We say, go to your church, go to your neighbor, a friend. I know sometimes people really don't want to rely on family. They don't want to put that strain on them, but sometimes you have to because you need that care and support. So it's very important that you just have to kind of step outside of your comfort zone and ask for help. And we can certainly implore you, to do that and kind of give you the support to do that. So as far as respite care goes, just give us a call and we'll screen you and place you on that wait list. So, you can get respite care, but it is a challenge when it is overnight and the weekend. Typically, respite care would just be for a couple of hours during the day because that's easier for agencies to employ staff to provide.
Thanks so much.
Yeah.
Let's see one other question that entered the
Yeah.
chat.
Anything else? Yeah.
It says, are there people who can get paid to transport a senior, like an Uber or Lyft for seniors?
You would have to become a business. You'd have to be, go through all of the ins and outs of becoming, a business. Typically through us in our resources, we use agencies who are certified businesses. Yes, individuals can use Uber and Lyft, but you have to just it can't just be somebody, off the street to provide that transportation. You have to be a legit business and you have to be approved to be able to provide that transportation to that person. It's definitely a good business model to get into because it is much needed, but you do have to go through that process to be a business.
And Ginger, would you say that it's generally that the transportation that is available, if it's available, it's the senior transportation options through the county?
It is, but there are some others. Goodness. There's one, a mind blank. There is another agency that's a business, and their model is that they're able to provide service for a discount. The senior transportation agencies may be $4, round trip. These other businesses, it may be 10 or $12, that sort of thing. So you would really have to find out what you can charge and still, make a profit, to support yourself in that business. But we do have a list of transportation agencies other than the county transportation, because one of the issues we run up on is the county transportation will not cross the county line. So, for instance, like I live in Gwinnett County, but I have a doctor that's in Forsyth County. Well, if I depended on senior transportation, they wouldn't be able to drive me to that appointment in Forsyth County. So I would need to reach out to one of these other agencies and probably would have to pay a little more, unfortunately, to drive me over to Forsyth. But that's something else that we also say to think outside of the box. Do you have a neighbor that maybe you can, slip them a 5 or a 10? I know with the price of gas, it's kind of daunting right now, but, perhaps they could take you. Or, some faith-based agencies have, that transportation option in their church. They also have friendly visiting, so, that might could help. It's a challenge. Transportation is a challenge. And we've had even where veterans have called us where they've had transportation scheduled, but they've had to cancel it because there was not a driver that day. And so that veteran, had to reschedule their appointment. And unfortunately, it'd be 3 to 4 months out. And that had to change because they couldn't get to the doctor's appointment because their transportation fell through. Yeah.
I had a question from a
Yeah.
caregiver the other day who
Yeah.
was thinking about doing the structured family
Hmm.
caregiving. I think she started the process, but felt like it was really invasive for her in terms of giving up her mom's information. But
Hmm.
she decided she wanted to pursue it, but she Googled there were different agencies that were offering, hey, we can help you do this. What would you suggest to her? To call just like in Powerline if she's
Hmm.
in
Hmm. That is a
that
great
can
question. Great question, because there is a lot of advertisements out there about structured family caregiver, how to be a paid caregiver. Well, in order to start that, you have to start with Empowerline. The screening comes through the Area Agency on Aging. So if someone is interested in being a paid caregiver through structured family caregiving, you would call us. And of course, we're going to get in the business a little bit, about your loved one because we have to determine that eligibility. And the person that's needing the service would have to qualify. And then once they have qualified, then the case management agency would then, start the process for that paid caregiver, because you can't have a paid caregiver if that client didn't meet the eligibility requirements. So what will happen is they'll call in. We're going to talk to them about their eligibility requirements. We'll talk to them about their income. Do they own a home? That sort of thing. And if they decide to move forward, then what we do is we move them on to a case management agency. They would select which one they want from a list, and that's probably what your caregiver is referencing, those agencies. So they're able to select which case management agency they want to go to, and then that case management agency kind of takes the ball from there. They become that case manager, and they're going to work with that family to ensure they get approval through Alliant, that they're providing all of the financial documents for the Department of Family Children Services, and then get them set up with the structured family caregiving program. But that will come last because they want to ensure that that client gets approved, and then they'll start the process, for the paid caregiver. And that paid caregiver will receive a monthly stipend. And sometimes that is a huge help because so many caregivers are unable to work. But this is a real avenue where they can care for their loved one and, um, have some income coming in. So yeah, it's invasive, but that's
is
how it
necessary.
is.
Yeah.
Yeah.
Are there any other questions out there? We are not seeing any other questions.
One thing I do want to say, I said it in my presentation, that if you don't know what you're looking for, but you need help, give us a call and we'll point you in the right direction. And even if it's something we're not able to help you with, if it's totally outside of our wheelhouse, we'll try to direct you to where you need to be.
Thank you, Ginger, for
Absolutely.
that reminder. So just remember, then we want to thank Ginger for all the information that she provided. And then next month, we are going to again be back on the second Wednesday of the month. Did we put up the information? No?
I was just actually looking for it.
Oh,
We're in the midst of a little bit of a few changes to our website, which y'all is super exciting because it's going to make the videos from the last 5 years now of the Dementia webinar series available on a landing page where you can go to on a regular basis. So I see Jenny put a link in. I think you can get to them there. But we will be sending out in May. We will have Katie here with who's going to be talking about safety in the home. And she's a fantastic occupational therapist who's very interested and well informed around how to best use sort of occupational therapy techniques in the home for safety purposes and how to really prepare our homes as we age, and particularly if there's dementia present. And you will be getting that flyer by whatever means you got the one that you got today. And there is a QR code on there now, and that will take you now to a landing page. Again, we're still working on it a little bit, but that will take you to a landing page where you can access all of our videos. And then please do let us know if there are things that you want to hear about. If there are particular sessions that you want to have where you're welcome to put them in the chat now. Or let any of us know. Ginger, thank you. It was
Thank
just
you.
fantastic.
Thank you. I love coming and talking with you all just to educate you on what's out there and who to call. So thank you. Take care of everybody.
Take care. Bye-bye.
Bye-bye.
bye, everyone.